Health experts told the members of the House Select Subcommittee on the Coronavirus Crisis Wednesday there are great COVID challenges ahead.
This is a once-in-a-lifetime pathogen.
The panel has not defined clear objectives, but will oversee the federal government's response to the coronavirus. The first hearing focused largely on the path forward. The consensus, better testing, remains at the heart of reopening the country. Former FDA Commissioner Dr. Scott Gottlieb told the panel the government needs to invest in collecting better data to keep the virus under control in the coming months.
We need to make sure that we get testing out widely and get testing most of all to the people who are at highest risk.
Testing was the fundamental failure that forced our country to shut down.
Contact tracing will need to be a key part of our strategy until widespread vaccination can happen.
Dr. Tom Inglesby, the director of the Johns Hopkins Center for Health Security, says the U.S. needs around 100,000 contact tracers now. Gottlieb says there won't be an end until the U.S. gets better informed technology and vaccines.
We may need to define a new normal.
The short, roughly hour-long hearing also highlighted the deep divide between the committee's 12 members, many of whom are well known for their opinions about President Trump.
It's a committee designed to go after the president. Didn't follow the rules, didn't give proper notice, didn't give the briefing memo, didn't give us any witnesses, didn't even ask the Republicans who we might like for a witness.
We set the timelines, time frame for this year, and based upon our guests. We did not want to impose upon them.
Republicans say in addition to figuring out how to reopen the country and overseeing the COVID-19 relief aid, it's vital for the committee to look into China too. This panel is just one of a handful with similar objectives. This is the only one with a Democratic majority, 7 Democrats and 5 Republicans. Outside of Washington, Alex Miller, Newsy.